Allergic stomatitis, as we can see, is a non-infectious lesion, a lesion of the oral mucosa which can be caused by chemical or plant irritant. It often happens that from the moment the allergen enters the body, it can take anywhere from 2 to 4 weeks for symptoms to appear. This is something you should always keep in mind as well. This diagnosis is not so easy to make, but you should always remember the possible causes that can, for example, trigger this allergic stomatitis. If it's contact related, you can always clearly see that, for example, if some chemical agent comes into contact with the surface, the oral cavity of a child, we can always determine whether it's, say, a burn or if it's allergic stomatitis developing right at the site of contact. But there is also non-contact type. For instance, there are certain foods we give to children. It could be dust, it could be mold, it could be some kind of bacteria, it could be plant pollen, it could be anything at all. For example, things that children usually play with in the yard, right? A child might try a flower or maybe taste an apple that has actually been treated with something and hasn't been washed yet. These kinds of reactions on the mucous membrane are possible. In adults, this can happen when using dentures, or the ointment that's applied under the denture, they very often can cause. Well, for example, what else can cause it? Specific dyes or so-called nature identical dyes, for example, orange, strawberry, those kinds. Well, actually, even the food itself can cause allergic stomatitis. It's not always a general reaction, but rather a reaction at a specific spot. What happens then? Naturally, like any inflammation, it manifests as itching, some burning, and unpleasant sensations in the mouth. The child either wants to drink or, on the contrary, tries not to drink at all, for example, right? If the burning is severe, even pain can occur. Very often simply eliminating something is enough. If you notice that literally eating a certain food or taking some medication or something else is directly linked to this allergic stomatitis, if the timing of its onset is clearly associated, for example, with the intake and the distinct appearance on the mucous membrane, then indeed you should restrict the child from that medication or food product. Or very often this occurs with fish, for example, or with certain shrimp. That's right. All of this is possible, and we see it all the time. What is used in such cases? Most often, common antihistamines are used. We try not to treat the oral cavity. It's very important to understand. We do not treat the oral cavity with antihistamines or antiseptics in this case. This is very important. They themselves can cause an allergic reaction. So here, elimination and avoiding the agent is key. 5 to 7 days is usually enough for this allergic stomatitis to resolve. If there are no other symptoms, just this manifestation and the use of antihistamines is sufficient. It will go away on its own. Fungal stomatitis. We will be looking at fungal stomatitis in children in the first days of life, or for example, in the first months of life. Source of infection. The source of infection is, after all, the child's close environment, someone who is already suffering from candidiasis, for example. This happens through direct contact or through household items that the child uses. Very often, on the contrary, wives and children can become infected while passing through the birth canal of mothers who suffer from candidal vulvovaginitis. What is the characteristic feature of this disease? It is a curd-like coat, and everyone has seen it. It can be seen on the palate, on the tongue, and on the inner surface of the cheeks. What happens? Children usually experience it without a pronounced high fever, although temperature increase is possible, as well as refusal to eat and various signs of discomfort in the mouth. Because of this, they may suck weakly or refuse to eat altogether. But there is, of course, no obvious high fever in such cases. And This should be kept in mind when making a differential diagnosis of fungal stomatitis. Both topical medications and systemic antifungal drugs are used. Topically, 1% methylene blue solution is used. There is also an acetyl salicylic acid cream, which is also very effective when applied to the child's oral mucosa. For example, treatment can be done in the morning and evening. But in cases of widespread candidiasis, when the doctor tells you that it's not limited to just the oral cavity and sees the disease extending further, which is possible, right? For example, in a child older than 5 years, in such cases, medications are prescribed fluconazole, itraconazole, oral medications, which are selective antifungal agents for ongoing treatment. Sometimes the course can last up to 4 weeks. Here, confirmation of the candidiasis process is necessary laboratory confirmation of a widespread candidiasis process. This should not be forgotten either, because stomatitis can be a manifestation of a widespread candidiasis process. In such cases, treatment is very prolonged under a doctor's supervision with monitoring cultures, blood tests, and extended medication use for up to 4 weeks, sometimes even longer.